Okay, today I want to talk about CT image quality, and really what we're going to talk about today is just how to identify CT images and how to identify structures in CT images and what CT images look like. We're not going to become radiologists, we're not going to learn to diagnose things in PACS, but I just want to give you an idea of what a CT image looks like and some of the basic anatomy and how to navigate them. So let's start with the brain. Here I have a CT brain. I'm going to highlight it, click on images, and I'm going to discard any changes I made to it. So it's going to come up in a 4-up format, and hopefully you can see this. I did this earlier on the Barco 6 megapixel, and the resolution was great and the boxes looked good, but the server over there caused audio problems and you couldn't hear me. So hopefully this will look good this way. So the first thing I want you to notice is two different types of brightness and contrast, or windows. So here we have soft tissue brain windows. So you see the bone is this big white circle, but you can see the parts of the brain. And over here we have bone windows. You can see the bone really good. You can see the marrow through there. You can see the top of the fontanelles. These little crack looking things here are the fontanelles where the bones have joined together. So when you're looking at CT studies, you'll need to know your body planes. These are axial images of the CT of the brain, and this is one scan. So they didn't have to scan them 2 different times to get these different type of windows. This is what reconstruction or reformatting does. They scan the patient one time, and then they can create the presentation state of the images using that initial data set to make these different types of images. So you have soft tissue for brain. Here you have bone. Again, you can kind of see cracks where the fontanelles are, and you can see the bone very good. Here the bone is all white, but you can see the brain matter very well. Here you don't see the brain matter. So as I scroll through this axial, you'll see again, right, bone just all white. Here you can see the bone very good. So this is a CT of the brain. And let's see if I can grab the sagittal and just plop it here. Let's go ahead and make that one up big so you can see it better. So this is a sagittal. If I said what windows are this, you would say soft tissue windows. You know this is soft tissue windows because the bone, the skull, is this big white blob area around here, and you can see the brain matter in here very good. So that's what a CT brain looks like. Let's go to a chest. Let's do CT of the chest. So I should have clicked on images. So here's a CT chest, and again we have different window settings. This is what we call lung windows. You can see that the lungs, as I scroll here through these 2 images, are very prominent. You can see all the bronchioles, all the markings inside the lungs. And over here you have the bone windows. You can see the spine and the ribs good, but the lungs are just black, grayed out areas. So this is actually a CT with contrast of the chest. Let's see if we've got some better images here. Let's make this one up big. So again, you can see that this is in lung windows, because as I scroll through the lungs, you can see that these lungs are very, you can see everything in the lungs is what I'm trying to tell you. And these are the scapula back here. That's the patient's scapula, right? So what if I wanted to see this in bone windows? I'm so glad you asked. I would just right-click it, go down to my presets here, click this, put it into bone windows, and voila. And now I can see the spine so much better. That's where bone windows is real obvious. And you can kind of see as I scroll through the ribs, you can see parts of the rib and parts of the marrow in the ribs. But look at the lungs. The lungs, other than a little bit of contrast, are very hard to see anything in. This is the heart. This is the front of the patient. This is the sternum, spine. All right, so as I scroll down, I get into the diaphragm and then the liver and into parts of the abdomen. So that's an axial CT chest. Let's go back and let's dive into an abdomen. No, I don't want to save any changes that I made to that. Just want my images. You booger head. So this starts, even though this is an abdomen, they're going to start all the way up in the chest to make sure they scan through the entire abdomen. So I'm going to put this one into lung windows just because I like to see it in lung windows. All right, so as I scroll up and down through the patient, here's the heart, right? And this is the liver, and this is the stomach. These are the kidneys back here. And these are intestines. All these blobby areas are intestines. Now I'm down in the pelvis because I see the pelvic bones. So I'm moving down into the patient's bladder, and these are his hips. These are the heads of the femur here. So white is bone. That's what an abdomen looks like. And of course, we have all three planes of this abdomen. So let's bring in the coronals. I'm going to make this one up big. So here's the front to back or coronal view. There's the spine, kidneys, spine. As I scroll further back, I go out the back side of the patient as I move forward. All right, I've got the liver here. This is the liver. So as I come through that, you see the liver. And again, you have bowel, large intestine. That's the patient's transverse colon. So that's the coronal CT scan. And hopefully this is a sagittal. Yes, here's the sagittal. So I just scrolled through the patient like crazy. So again, you have the liver here, you have the spine. As I move forward, you can appreciate different structures within the abdomen. That's what an abdomen looks like. Let's do some spines. This is a cervical spine. So here we have axials of the cervical spine. As I scroll down, you'll see different parts of the cervical spine. Right, and now you can see I'm down in the chest because the lungs are prominent there as I move up and down. And this little line moving here as I scroll, you'll see a little line moving here. That tells me exactly what level I'm at. These are scout images, and they have those levels, so you see the line moving here. Again, I can just click and go to a particular level, and as I click here on this image, you see this image is moving. So let's bring in coronal. Now I'm scanning front to back, and you see the line has changed. Now the line is going in the coronal plane. And let's try a sagittal. Right, so now you see the line over here and over here as I'm working side to side through the patient's neck. And this is a cervical spine CT. Let's do a thoracic spine just below the cervical spine. So here's the axial. Again, you can see the vertebral body and associated structures with the thoracic spine. You'll see all the ribs connecting. And here's our coronal. Oh, yes, this is the coronal, which I've made one up big. And finally the sagittal. This is what a thoracic spine looks like. Finally, let's do a lumbar spine. So what plane is that? Axial, yes. So this is your lower back. You can see the vertebral bodies. Spinous process out the back. Looks like they did a second set. These are in bone windows. And here's our sagittals. Again, this is what a lumbar spine looks like. The lumbar spine is there. And let's not forget our coronals. That is what a lumbar spine looks like in the coronal plane. So that's real quick how you look at CT images. Thank you for watching.